Should we start now?
Just give it 1 minute to let everyone join.
Okay. I saw Zippy here.
I think we can start, Tom. That sounds good.
Okay, cool. I see boys joining. Good morning, good afternoon, and good evening to everyone. Welcome to the webinar today. Before we start, please note that this meeting offers interpretation for English, French, and Spanish. To listen to the original audio, please select original audio from the interpreter button below. And for English member, please select English when any French or Spanish speaking participants are talking. I will give you 1 or 2 minutes to find the buttons and to open interpretation. Yeah, so here is the agenda for today webinar. We have the welcome and opening remark from Y Global and World Hepatitis Alliance. Afterwards, we will have the small slides about the intersectionality of HIV and hepatitis, following by the fireside chat. And you have opportunity to give the question to speakers. And then we have the small updates about the AIDS 2024 conference, and then we can close the webinar today. Great. I saw more people are joining. So I think we are good to kickstart the webinar today. Once again, hi everyone. I am very delighted to welcome you to our super exciting webinar today, From Experience to Action, Youth Voices on Hepatitis and HIV, organized by Y Global in collaboration with the World Hepatitis Alliance, WHA. My name is Tung Doan, Senior Advisor for Program Management at Y Global, and I am honored to co-chair this important webinar today with Ms. Adesuwa Oni from Rise Against Hepatitis Nigeria. Yeah, yes, he is. This event is unique as it may be one of the first global discussions on the intersection of hepatitis and HIV for young people particularly. It's crucial to view these issues and solutions through a comprehensive and diverse lens. Our aim is to bring together youth voices from around the world to share their experiences and insights on living with hepatitis and HIV, and also discuss the potential collective solution, especially advocacy resources needed to support them. For years, Y Global has been dedicated to addressing the issues of young people living with HIV globally. We prioritize community-centered approach to address their unique needs and meet their diverse needs. With the intersection of HIV, hepatitis, and TB being a top priority of the organization. We are not working alone. We have been empowering and amplifying the voices of thousands of young people to promote our right to live healthy and fulfilling life. Today, we are excited to have you join us as we share the first-hand experiences, stories, identifying gaps, and collaborative find joy solution for future advocacy effort. Following our discussion, WHA and Y Global will develop new advocacy and educational materials to be launched at 8/2024 ahead of World Hepatitis Day on July 28th. To conclude my speech, we extend our gratitude to World Hepatitis Alliance and all of esteemed speakers for their great partnership in this critical webinar. Let's make this webinar a truly productive and inspiring event. Now I would like to invite my co-chair, Adesuwa Oni, to share her opening remarks. Adesuwa, we cannot hear you. You are muted.
Sorry. Hello, everyone. Can you hear me now?
Yes.
Okay. Good morning, good afternoon, and good evening from all over the world. Yes, I'll be co-chairing this webinar with my colleague, Tong. My name is Oni Adesua from Rise Against Hepatitis Global Initiative and also a member of the World Hepatitis Alliance. The World Hepatitis Alliance is an international network of organizations working in over 100 countries towards the goal of eliminating viral hepatitis. Our network comprises of civil society and community organizations across the world with the aim to fight viral hepatitis through various tools such as advocacy, capacity building, and raising awareness. Of course, we are led and governed by people with lived experiences of hepatitis, and these are the people that we do all we do for. Our hearts are with them all the way. Also, I would like to include that WHA have previously convened stakeholders to discuss the needs and experiences of young people living with hepatitis. This also includes hosting webinars, just like this one today, and a podcast, as well as a section at the World Hepatitis Summit held in Lisbon this year. Lastly, I would also like to emphasize that this webinar aims to enhance meaningful conversation and gather insights from young people living with viral hepatitis and HIV. And also, following this webinar, WHA and Y Global will develop new advocacy and educational materials to be launched at 8 this year ahead of the World Hepatitis Day in on the 28th of July this year. Thank you very much. Okay, at this time, I would like to ask our panelists to introduce themselves. Priscilla, would you like to start?
Yes, I would. Thank you so much, Adesua. Hello, everyone. My name is Priscilla Ama Ado. I am the Communications and Advocacy Graduate Training for Y Global, as well as Youth Health Leader with Young Health Advocates Ghana. Thank you so much.
Okay, Edgar or Zipporah, which of you would like to go next?
Hello, everyone. I'm Dogo Edgar. I'm a medical doctor by training. I am glad to be part of this team. I am from Uganda and I am based at Mbarara Regional Referral Hospital. I look forward to sharing with you.
Thank you, Edgar. Zipporah, please introduce yourself. Hello, Zipporah. Okay.
Hi,
Please go ahead.
everyone. My name is Zipporah Chieng, a HIV champion, a hepatitis champion. And yeah, I'm happy being an advocate today. You may hear from young people. Thank you.
Okay, thank you to all our speakers. All right, over to you, Tong, for your presentation.
Thank you very much. Once again, I would like to extend our heartfelt thanks to our wonderful speaker, Priscilla, Edgar, and JP for your times and contribution to this webinar. As I have shared, it is clearly that HIV and hepatitis are posing disproportionate health challenges to young people globally, especially those marginalized and underserved. Before we move on to the insightful fireside chat with our esteemed speakers, I would like to quickly cover some basic information and recent scientific advancement related to HIV and hepatitis, as well as their intersection to ensure we have a common understanding. Can you move to the next slide, please? Yeah, to begin with, let's take a look at some key statistics. As you can see, 2.7 million people living with Hep B are also infected with HIV, and 7.4% of people living with HIV are co-infected with Hep B, and an estimated 2.3 million people live with both HIV and Hep C. This number really can speak right. They highlight the significant overlap between this hepatitis and HIV and required the collective and cohesive solution. Can you move to the next slide, please? Yeah, so young people are particularly affected by hepatitis and HIV. Unfortunately, there is little data on co-infection among these groups. In 2022 alone, nearly 500,000 young people aged 10 to 24 were newly infected with HIV, including more than 30% adolescents aged 10 to 19. Over 4.7 million children under 5 live with the chronic Hep B, and around 3.3 million children and adolescents have Hep C. The younger someone is when infected with viral hepatitis, the higher the risk of developing chronic infection and more burden on them. Next slide, please. Hepatitis and HIV share several ways of transmission, such as mother-to-child, injection drug use, and sexual contact, and lack of information, unfriendly services, stigma and discrimination, inequity, and criminalization are common barriers. This commonality underscores the needs for integrated awareness raising, prevention and treatment, and also advocacy strategies. Next slide, please. Now we can jump into some advancement and updates about the hepatitis. The fact is that hepatitis is an inflammation of the liver, most commonly caused by a viral infection. There are 5 main hepatitis viruses. Most of us know about the Hep B and Hep C, but there are the different types of viral hepatitis, like we have types A, B, C, D, and E. Hep B, Hep C, and Hep D can cause acute and chronic or long-lasting infection. Chronic hepatitis can lead to complications such as like cirrhosis and liver failure. I often call hepatitis a silent killer. Hepatitis is the leading cause of liver cancer, leading to 80% of all liver cancer cases. And Hep B can easily be prevented through vaccination, while Hep C can be cured. Next slide. Now let's take a look into the HIV field. Most of you know about the HIV, right? So HIV attacks the body immune system, specifically the white blood cells called CD4. If left untreated, HIV can lead to the disease AIDS. Using condom is still an effective and affordable prevention measure. So use condom correctly every time you have sex. So that is a key message, right? Self-testing and new generation tests are available for early HIV detection. Early diagnosis can lead to the better health outcomes. And we know about the pre-exposure prophylaxis can significantly reduce the risk of getting HIV. Antiretroviral therapy, ART, helps keep the viral load low and maintain a healthy immune system and reduce the risk of transmission. And taking early ART and maintaining adherence to the treatment can lead to a better quality of life for people living with HIV. And lastly, you may heard about you could use or stand for undetectable equals transmittable. Evidence and research has shown that HIV treatment is highly effective in reducing the transmission of HIV. The evidence is now clear that people living with HIV with an undetectable viral load cannot transmit HIV sexually. And last slide, please. Yeah, so this is last slide. The fact is that despite significant advance, young people living with hepatitis and HIV often receive little attention for their needs and their issues. Access to services for children, adolescents, and young people lags behind that for adults. They face similar issues, including stigma and discrimination, a person-centered care approach, with civil society and community play a central role, can ensure that hepatitis and HIV services meet young people's needs and leave no one behind. Yeah, so this is my last line. It's very briefly about the HIV, hepatitis, and intersectionalities among them. Thank you very much for your attention. I hope this can set a foundation of knowledge for the next exciting section, Fireside Chat. Hence, I would like to give the floor to my co-chair to continue.
Thank you, Tong, for that presentation. Obviously, the common ground between hepatitis and HIV cannot be overemphasized. Okay, next we'll be moving into the fire chat section. Now, Priscilla, I would like to start with you. Can you share a personal experience or story about living with HIV that has significantly shaped your advocacy work? I know you have more experience and you want to share your story with us. Thank you.
Yeah, thank you so much, Adesua. So my experience really started quite early on, living with HIV and not knowing till I was around 15, 16 thereabout. And I can say that I had the better end of the bargain because I had a really supportive mother, which many young people living with HIV do not have the opportunity to have a supportive family system or to have a supportive mother by their side. My leading up to my advocacy journey, I think it really started when I had the opportunity to work and volunteer with a civil society organization based in Ghana here, known as Hope for Future Generations. They were really instrumental in my upbringing because as a young person living with HIV, having no support system whatsoever, it becomes really, really difficult trying to find out who to talk to, where to get services, who to access quality advice from, because it's a very isolating experience. I will not lie to you about that. And it can, coupled with teenage feelings, it can really drive one over the edge. And I say this because at a point in time, that was 4 or 5 years ago, there was not a solid platform for young people living with HIV and adolescents living with HIV to meet and have this support system where they can access accurate information on sexual reproductive health and on HIV as well. So it took sort of a collaborative measure to working with this civil society that is Hope for Future Generations and sort of being mentored by this civil society organization to co-create a platform that is now known as the Young Health Advocates Ghana. And I say I keep going back to this civil society because it was a really instrumental platform that created a youth-based, youth-led network or support group where young people could, one, be mentored and empowered to lead capacity building sessions amongst their peers, where it felt that programs were co-created and they were led and supported by young people. And there was this feeling of belongingness because everyone there was like you. Whatever challenge you were facing, they were also facing the same thing. And it also gave me the opportunity to also inspire other young people as myself, because you get to acknowledge that not everyone had the access that you had. With in terms of meeting policymakers, being trained or being mentored having your capacity built, being empowered to interact with stakeholders. It gets really scary for a lot of people because of stigma and discrimination. And so young people tend to shy away from that, because if you're going to be interacting with the media on HIV matters, you are definitely going to have to disclose your status at a point. And a lot of young people were not comfortable with that, and even myself included. But it took a lot of empowering to be able to, be comfortable to talk about such issues as I am speaking about them today. I did not start, knowing it all. It took a lot of learning. It took a lot of processes, a lot of watching older people who are like myself, learning from them, being mentored by them, and eventually being comfortable enough today to sit here and also share my advocacy journey. And I think it has really been a stressful but really educative process. I say this as a stressful one as because being a young person living with HIV and having to conceal it every time when you are in school, as someone who attended boarding school, it was really stressful. I'm not going to lie to you. It was really, really stressful. And I had a mom who was really super protective of me because of that. And so it took a lot of concealing, wrapping around it, putting behind a wall of lies, just to ensure that I'm able to take my medication correctly. And adherence is really important at a young age. A lot of adolescents and young people are not even disclosed to, and so it's a real issue when they don't know what they are dealing with and they are forced to take medication. Sometimes parents come to me to educate or to sort of encourage their wards to take their antiretroviral therapy, and then you find out that these parents have not even disclosed their child status to them. How can you encourage someone to take medications when you haven't told them why they are taking the medication? So my advocacy journey has really been really a really interesting one, honestly, one where I have been able to evolve, and I've also helped many other young people like myself to evolve along with me. Thank you so much.
Thank you, Priscilla. I'm glad to actually see you and hear you speaking about this with such an amusement and excitement. Yes, I hope her story will encourage young people to come out of isolation, and thereby it will humanize this disease and also encourage people to seek testing and treatment. Thank you, Priscilla, once again. Okay, Edgar, are you ready? Can I ask you your question? From your
Yes, please.
perspective as a doctor, thank you. What do you think are some of the biggest challenges for young people living with hepatitis or HIV and their understanding of co-infection? Please share with us. Edgar. Hello, Edgar, are you there? Okay, since Edgar is not, network has been disconnected.
Yeah, I can go to Z.
Okay, please, Tom, go ahead.
Yeah. Thanks, Flisola, for sharing a very beautiful stories. Zippy, you recently attended the World Hepatitis Summit in Lisbon. I was there too. It was such a great event. So what did you learn from this experience, and how can these takeaways be applied to your advocacy work?
Hi everyone, my name is WHA, a HIV champion and a hepatitis. Yes, it was my first experience being in Portugal, Lisbon for the first time for a hepatitis summit. I think we have a lot of work to do because each and every day we are getting new cases, of which we can't say that we have reached the end or we are going somewhere. And I will say that the experience was good because I got to know that it was not only us that we are suffering from hepatitis. There are many people out there who need the help too. So in my advocacy, I will say that you made me to be strong because of the compliment that you gave me. You told me that yes, I'm a beautiful story, everything like that, and it gave me a vision to go to the world and continue teaching about it, talking to people, giving them information, taking the people who need help to the hospital, telling them that this is not the end of life. At least embracing someone makes someone feel that it is not the end of life, because I think they have the right to live, and in this it matters a lot, because for me I came to know my hepatitis story after I was diagnosed with HIV, and at first it was not good because I was struggling to reach you girls. I was struggling to to do many things where I was scared and I didn't love the life I was living, but I will say that to me, at some point, I am happy because I always help other people out here by talking to them, giving them the testimony, telling them that I am Zipporah Chieng, living with HIV and hepatitis, and today I'm here. If you follow, the doctor will tell you everything is okay. And you see, like, when everyone sees this, the young people always see you living every time, they follow you. And I remember there was a time I told one of the doctors that he was taking care of us when we were young. I always tell her, remember you are here because of us, and we are here because of you. So when you fall, we fall. So like even me, I believe that people, like children in my community, know me, and at some point they feel that they are strong because they are seeing GP is always alive and doing the right thing that she's telling us to do. So in my advocacy, I will say that um, in the World Hepatitis Summit, give me the they give me the urge to continue, and they give me the more, like, they they made me to be strong, and I feel like I should continue even though we yeah, I'll say that.
Thank you very much, Zippy. I'm happy to hear that you overcome all difficulties and challenges, and now you become a champion on HIV and hepatitis. And you decided to continue your advocacy work to tell people proudly and loudly about like your old stories and increasing other people living with hepatitis and HIV. Thank you very much for sharing that. The next question to Frisola. Hi, Frisola. How can you leverage your experiences to do more work around hepatitis and HIV?
So because from the introduction on hepatitis that you did, we got to know that hepatitis is a co-infection, and the mode of transmission is actually really similar to that of HIV. And people who suffer from hepatitis are also stigmatized. You know, they go through the same stigmatization as that of HIV. And so this really brings it down to a point of similarity, that when advocacy is going on for HIV, it is also very imperative that advocacy for hepatitis follows in as well, because they are, they are sort of in the same basket. And this is also really new knowledge to me, because when you are living in a world of HIV where you are at a risk of suffering from a lot of co-infections, it becomes difficult to keep tabs on which one is, which one can you also get from the same mode of transmission. And we keep preaching about condoms. We keep, advocating or educating people to practice safe sex. But most young people are more worried about pregnancy more than the sexually transmitted infections that they are at risk of. And so I think it is very, very important that when we are doing these advocacies on HIV, it is very important that we include education on hepatitis. We also look at the programming, the campaigning. When we are celebrating important international days like World AIDS Day, it is also very important to have a component that hepatitis also exists in its various forms. A to E, that is very scary. And so we have to remind people in our advocacy on vaccinations, the type of hepatitis that people can get vaccinated against, and the prevention modes. People need to be very crucial and very protective of the ways in which they go about when it comes to their sexual relations. It is really, really important that when we are talking about safe sex or safety in sexual relationships, it is not only to, prevent pregnancies, but also to look at preventing yourself from these diseases, which are very much preventable, or getting vaccinated against these diseases as well. Thank you so much, too.
Thank you so much, Priscilla. Wow, it's really great. Obviously, we have a lot of things to leverage from your experiences working as the champions for HIV and also hepatitis. I hear you. We need to have more education. We need to have the integrated HIV and hepatitis awareness raising campaigns and also services for young people. Thank you very much. So now I will give it back to Edesua for continue the discussions.
Yeah, thank you, Tom. And Priscilla, also, with your experience, you could really do a lot. You could collaborate with organizations to implement some programs. You could also, work hand in hand with them to develop research projects that can actually share insight in patient experience. Thank you for that point you just mentioned. Okay, Edgar, welcome back. Now I'd like
Thank you.
to share your perspective as a young doctor. What do you think are some of the biggest challenges for young people living with hepatitis or HIV and their understanding of co-infection? Please, can you share with us?
Thank you very much. Thank you, Priscilla. Thank you, Doan, for sharing with us. I realized in my time that I've been dealing with these clients, the challenges both come from the clients themselves and some come from the system or the healthcare system in which we work. But importantly, unlike a lot of advocacy that has been ongoing around HIV/AIDS, we have very little concerning hepatitis B itself or concerning hepatitis B and HIV co-infection. I received a gentleman a few weeks ago. He had been with symptoms of hepatitis. He was in the village and his body started to swell. Unfortunately, the people around him kept on advising him and encouraging him that he had started getting money, because the belief is that whoever gets money puts on some unnecessary form of weight. So he came in when it was late and it had progressed to cancer of the liver, and it was that unfortunate. So that's one of the challenges. The second is on our side as the healthcare system, they are not adequate and enough imaging modalities and laboratory tests, because in a few facilities that I supervise, I realized for the last about 6 months, they have been out of stock for strips that do test for hepatitis B. And this poses a great challenge that whenever they come, they probably have to be referred out. And at the end of the day, they end up not getting the service. The other challenge is, the one I think mentioned it, we have a lot of stigma around HIV, but it's even worse now around hepatitis, because we have gotten a better understanding of HIV infection. Unfortunately, for hepatitis B, hepatitis C, and other forms of hepatitis, we are still lagging behind. A few of these clients that I have seen, there is poor adherence, and especially in the age of adolescent. Usually between 14 and 21, we have a very big challenge with controlling the hepatitis B and C viral loads. And this is some you might attribute it to stigma, you might attribute it to lack of information and the need to keep the viral load undetected or suppressed, because we have earlier been told that suppression is almost equal to non-transmissible. And we also get challenges with the school-going adolescents, especially when it comes to time for their follow-ups and their review dates, because some schools are not open to allowing these students to move out. The process is a bit hefty. They need the parents to be around, they need the caretaker, and sometimes it interferes with their ability to come for their reviews and refills for their medicines on time. And this is also associated with a few who lack transport costs to move to facilities and back to their homes, and some who are actually delayed at healthcare points. So subsequently, they feel discouraged to come to facility because they know every time they go to a hospital, they usually have to spend about 4, 5, 6 hours. And for someone who is employed, for example, you might not be able to miss work for about 5, 6 hours if you have a strict board. So those are some of the few challenges that I have met with working with adolescents that have either HIV with hepatitis or hepatitis B or C alone.
Thank you, Edgar. Yes, thank you for those points you just mentioned. Of course, we know education still remains the most potent tool in this our advocacy work. And also discrimination, as we mentioned, is one of the most substantial barriers. You know, this discrimination can actually make young ones to go on self-isolation. It could also lead to mental health challenge too. So I will encourage policies. I will encourage all advocates to work towards policies that will actually protect the rights of young people, the right and confidentiality on the part of healthcare workers too, to protect them from all of this stigma and discrimination challenges we're experiencing. Thank you once again, Edgar. Okay, Zipporah, I'd like to ask you some questions here. What are some of the main challenges you have experienced in the world around hepatitis and HIV? You could also mention what types of digital resources or tools you think are most needed to support young people living with hepatitis and HIV. Deborah.
Yes. Can you hear me?
Yeah, we can hear you.
Yeah. Okay. I will say that the challenges first. Okay, I'll talk about my experience. Is that people don't have that much information, and again, people have the old perspective whereby they knew when you have hepatitis or HIV, you are not a person. Actually, you are supposed to die. You have to live for sometimes, then you died. But they don't understand that there is medicine, and now that the world has evolved, someone can live. Then again, here in Kenya, treating hepatitis is very expensive compared to HIV, because the doctor can diagnose you, but you'll have to buy the medicine. And again, I would love that for the tools that are needed to help us. First of all, I will say that I am already a tool, because I use myself as a living testimony, where when I talk, someone can relate with whatever he or she is seeing. And for me, it has been a great encounter, because since I came out of World Hepatitis 2024, I have achieved more than 30 boys and girls who are now continuing with their medication, even though there's tough consequences that they have to get, maybe the poverty that it is currently in my country, and again the rain that is there. But at some point, I've heard that people are now joining hands in helping fighting the discrimination, because I will say that I will not feel good when someone discriminates of something which I have. Yes, I can't hide it, it is in me, but I will not feel good when someone comes from nowhere and starts insulting me. So you find these things brings a lot of fear to many children, many youth, and some of them choose to keep quiet. Even some of them choose not to go to the hospital, because they fear if they go to the hospital, maybe the neighbor was there taking his or his child. She will see that this girl is entering different room than mine. Why is she going to go there? And maybe he or she can go and ask, and maybe they'll tell her this girl is suffering from hepatitis, maybe HIV, and maybe it was not the right time for that disclosure. So you see that many youths are fearing to go to the hospital because of these things. And once we join hands together and talking about it, if yes, I was born HIV and hepatitis, I will stand boldly and say, even you, because I always tell myself that it doesn't matter where you got it from, but I will say that sometimes maybe if we join hands together, it will be okay. And even if we partner with some organizations which are there to help us, it will be okay. Because person like me, if I've been asked if I've seen any organization here in Kenya that it is dealing with, I will not. I will say no because I've never seen one. But when I went to Lisbon, I met with one woman and she was very sweet and she explained to me. But for some people who doesn't have this information, where will they get them if we don't stand up and talk? So we need to talk, we need to create awareness, we need to create a campaign that can help other people.
Thank you, Zipporah. Yes, we have so much work to do on the advocacy journey, more campaigns, create more awareness, address stigma and discrimination so people can be encouraged to get tested. Thank you for sharing your story with us, Zipporah. Okay. Tom, please can you go ahead?
Hi, sure. Thank you so much, ZP and Edgar. I saw a lot of comments in the chat that people wish you, and also thanks you for bringing the lived experience as people living with hepatitis and HIV. The next question go to ZP. ZP, what types of digital resources or tool do you think that are most needed to support young people living with hepatitis and HIV? And what resources currently exist? Sorry,
Zipporah is connected.
yeah, I'm sorry. I don't think that ZP is still in the call, right?
Hi, sorry, my network is at some point not okay. Can you hear me?
Okay.
Yes,
can hear
we
you.
can hear you. Yeah.
Don't come again with the question.
Yeah, so just I think the last question for this fireside chat, it could be great if you can share any kind of like digital resources or tool that you think are more needed to support young people living with hepatitis and HIV, and what is currently exists and what is the tool that you think we need to develop in the future.
Yeah, okay. Actually, about taking the tool, we all know that now everyone there are some youth who have these phones, these smartphones, whereby it will be okay even if we create maybe an app where someone wants to know, maybe when someone has questions to ask, maybe she can go to the app, download it, and maybe she can have uh, maybe a conversation with the app person that will be there talking about everything. And again, I think that we have these Facebooks, TikToks, and everything that we have in our phones. At some point, I always take my time. In Facebook, I always talk about my experience. And you always see after that post, every people wants to get in my inbox and ask me a lot of questions. So if one, we have an app where it talks about HIV and hepatitis, where someone, if one is scared, cannot meet anyone, has to go to the app and he or she will get the information. Second is us, the people who are living with HIV or hepatitis. At some point, if you have that knowledge, you can be using it, because many many youths are using phones. Some of them are in TikTok, some of them are in Instagram, some of them are in everywhere that the medias that we are using currently. A lot of youth are accessing it. So I would love for us to have that platform whereby you talk to you talk to the people about your experiences, and the people who are silently suffering will learn from you. because at some point they can't reach you in personal, but they can reach you when you talk to them. And I'm sure that when you tell them that I was born HIV positive, I was born hepatitis, I took my medicine, I did this, I always visit the doctor. When I have this one, I always do that. When I have to have a relationship with someone, I use protection. You see, this one even it will help us to reduce the risk of transmitting. Because if we hold hands, taking the women who are pregnant and living with hepatitis, when they get vaccination and when they are given their medicine, I'm sure when the children are born, they won't have those they won't the children that we are taking care of won't be born with the hepatitis or anything, but we will love to have them together and it will help us a lot. So the change starts with us, whereby we will maybe if we get some trainings too, it will help us, even us to go. And now when you talk like someone who has learned, whatever you're talking, you're not talking about experience, you're talking about something which you have learned, something which you know. So one was an app, second was creating awareness, and third was the trainings. There are trainings there. Take us there. We learn so that when you talk to someone, you tell them, I'm talking as a trainee, I'm talking as a person living with it, and it will help a lot.
Wow, thank you very much for sharing quite a lot of great ideas for our future works to create the platform and also the tool for young people. And I think it's linked quite well to the question in the chat, in the Q&A function. And I also saw Priscilla already answer to Ravel Gatoto from Burundi. So what GP just shared, I think it is a great way that we can using digital platform to share our life experience stories to inspire the other young people. And we also can use that for advocacy at like our community level, in the country level, and also in the regional and global level. So for your question, Ravel, I would suggest that you can follow Y Plus Global and also WHA, World Hepatitis Alliance website and fan page for our upcoming activities and campaignings and the other events where we generate the contributions of community for their stories and also for their like life experiences and other ideas for our works. So yeah, do encourage you to go to online and follow Y Plus Global and WHA. Yeah, so now I will give it back to Adesuwa for any further question to our speakers.
Thank you, Tom. Thank you, Priscilla, for your Edgar and Deborah. Thank you so much for your wonderful conversation since this webinar began. So while we wait for more questions, please, I would like to inform our participants to ask questions. You can raise your hand, and when you're called to ask a question, just unmute your mic so we can hear you. So while we wait for more questions, I would like to ask any of our speakers, what can we do to ensure that young people are left behind in the hepatitis and HIV response? To ensure that young people are not left behind in the hepatitis and HIV response. Any of our speakers can speak first?
Yeah. Let me say on what we can do. I think my ideas can help. Like first of all, we have to train the people who the new cases that you are getting every day, because every day we are having new cases. So I think when the person goes to the hospital, let the person have the expression first. Let the person choose, because there are some people who, when they will be get tested and they'll tell that you have hepatitis and he or she doesn't have information, definitely she's not going to take the medicine that he or she's being given, and that's a threat to us, to the people who are out there whom doesn't have this information. So it will be greater if we join hands together and start talking to, even if we have these programs to the hospital in talking about hepatitis the way HIV is being talked every day about. Even hepatitis, it will be great, because I'm sure if GP will go there and tell people, even if It doesn't matter if you have hepatitis or not, but for you to, maybe you might get someone there. When I was in Lisbon, I talked about my daughter. I have trained her. She knows. Even when my sister will sit down and say that today I'm not feeling okay, my daughter will go and bring medicine, because she know when you are sick you need medicine. So if we start teaching them, I think stigmatization one, we will kill it, because I'm sure before someone comes and starts discriminating you, that means that this person doesn't have information. But when you start talking to them, teaching them, for the negative ones, for them, for those who doesn't have, we're telling them that we are living as sisters and brothers. So when you meet someone, when someone tells you that I have HIV, I have hepatitis, I have anything, please help me, help her in one heart, because you never know tomorrow. And every day I always tell my community that hepatitis does not knock the door that I'm coming to your life. You will become sick, go to the hospital, get tested, and the doctor will tell you, sorry, we have diagnosed you and we have found you that you are having hepatitis. The person doesn't know. So not everyone who is having hepatitis or HIV has to be discriminated. And this change will start with us when we wake up, hold our hands, take breath, go to the community, tell the people that it doesn't matter. Like I know the transmission is similar from HIV, but nowadays things have changed. When you see someone with hepatitis, don't discriminate her, but encourage her. Take her to the hospital. Because when I was growing, my mother always telling me, people, your hand has carried a lot of people. When you trip the hand, many people are fall. Meaning you have to take your medicine in order to protect everyone. And the testimony came when I first gave birth to my daughter. When she was tested, she doesn't have HIV, she doesn't have hepatitis, but here she is. And I'm training her to be like other people, to go and help. It doesn't matter. You have to help people with hepatitis because you have hepatitis. I'm sure even people who are in this seminar, in this webinar, not everyone is sick. But you see, we are joining us to help people. So the same spirit we are having is the same, that we have to help other people out there, because these people now they see that it's the end of life. For someone like me, I know it is not, because I've been trained, I've been taught, I've accepted myself. But to the people who are out there, what about them? So before we do everything, let's think of their heart. Let's think of how they will react. Let's think on how they will feel. And I know before 2030 we will say that we did this, and today we are living as brothers and sisters. And before I finish, I will leave this imagination. Imagine, sit down, meditate, and just say that when we are in a free world of free hepatitis, free HIV, where when you go to the hospital for new cases, and you tell your person will not tell you, VP, I'm scared to tell my mother that I'm having hepatitis. You go to the hospital, the doctor tells you, ZP, you are hepatitis positive. From there, I'll tell the doctor, okay, what am I supposed to do? The doctor will tell me, take medicine. When I go home, I will not fear telling my mom. I'll tell my mom, Mom, today I went to the hospital, have been diagnosed with hepatitis, and the doctor told me to take medicine. You see that how free it is. And I think we will not have that much death that we are having now, because of scaring that if maybe Tum knows that I'm hepatitis positive, he will hate me. No, we have to live in a free hepatitis world and HIV. So we are the one to talk to the people. We are the one to tell them, and you are the one to guide them on what to do. If they met this one, they have to do this. If you are having this, do this in order for us to suppress. And we never know that they will come to a lifetime where we are now, you are positive, but you can give birth to a negative child.
Thank you, Priscilla, for that heartfelt expression over there. Yes, I think I have one question at the Q&A section from Ravel. The question goes to Priscilla and Tom. Are there ways to engage reality lived experience of young people living with HIV as himself in conversation or active spaces?
Hi, Adesuga. I believe that we already answered this question through the others while during their speak. But yeah, I just want to remind about the Priscilla response that there are many ways, example, using digital platform to share messages like Y Plus Global we are doing here, to do the social media campaign, and also to join with the other like organization like Y Plus Global or WHA to joining in our campaigns and also the other activities. I believe that in the chat, there are a really critical question from Alexandra to ask not to only the speaker or panelist today, but also to everyone. Please share any ideas or any comments for the new advocacy resources for young people living with hepatitis or N and or HIV. That is helpful for young people to raise their voice and advocate for their needs. And I just saw a new question from Shannon. We need to look at more youth-friendly ways to make youth and adolescents living with HIV and hepatitis adherence to medication, treatments, and testing, and putting up ways for young people living with HIV and hepatitis to get more information and combat stigma. Clearly, stigma and discrimination reduction and also digital solution and also advocacy are really critical, and I saw us repeated again in the chat. And hopefully that in the near future, we can have more advocacy resources and tools for young people to leverage their experiences and to share their lived experience with hepatitis and HIV on advocacy and also the other activity. Well, I think that's all question we have for now. Perhaps like I have last question to either Priscilla or Edgar. Can you please, as we have a lot of advocates here today, so how how the advocate they can work together to have the better future for all of us. So I don't know if Edgar or Priscilla, you want to come up and speak briefly about that.
Okay, thank you, Tom. This next part of my discussion calls upon all of us on this call. There is a fear that we are engaging the right population and the right category of people, but we are also missing a key player within what we are discussing today. I think if we have to address and cause a reduction in stigma among the adolescents living with HIV and hepatitis co-infection, we will need to address where they stay. We need to address the people that they stay with. We need to address the people around them. It is because the people, our adolescents who are living with HIV, hepatitis B co-infection already have some idea about an illness because they have been briefed in hospital, they have been talked to. The challenge comes about the people around them who are supposed to be reminding them to take their medicines, reminding them to go for checkups, reminding them to go for follow-ups that actually confer this stigma onto them. So I think subsequently we will need to engage the people they stay with. We engage their teachers if they are school going. We need to engage their siblings. And lastly, I have also been pondering about how possible it is to engage adolescents generally in areas where they spend most of their times, like social events, like competitions. I think that's why we shall find most of them, and the message will spread to a multitude using preferably less resources. I submit. Thank you.
Thank you very much. I think that is very brilliant, sharings and ideas, and thank you very much for that. I saw that we are running out of times for the webinar today, but I hope that you can stay for a few more minutes. So now I will give it to Eddie and also Edisua to give the very brief update about the AIDS 2024 and World Hepatitis Day events.
Thank you, Tom. Yes, I would like to inform us that the World Hepatitis Day, which is coming up on the 28th of July this year. We usually have this the event every year on the 28th of July. And before then, the team and other advocacy tools will be out. So I would just encourage us to look forward to it. And also the materials that will be developed from this webinar will be launched on 8/20/24 ahead of the World Hepatitis Day. So I encourage us to just stay tuned and we'll get the material. Eddie, thank you.
Thank you so much to all the panelists. I want to say how grateful we are for your contributions to this very important conversation. I think what has been made clear is that hepatitis and HIV are often discussed as separate health issues or on the sidelines, and it's important that we highlight the interconnectedness of the co-infections and the inequalities that a lot of young people still experience but are often not addressed. So we know that there are a lot of great examples, as highlighted by a wonderful panelist today, that young people are doing at the country and regional levels, and it's time that we amplify those initiatives at the global level. We heard about stigma and discrimination, support systems and a lack thereof, medication, education, digital platforms. And like Tung said at the beginning, there is little data about co-infections, but we are not alone, and we're looking to change that. And that is why World Hepatitis Alliance and WHA Global have embarked on this collaboration. And it's to identify those gaps and solutions and to strengthen the advocacy efforts. As some of the speakers already mentioned, we hope to develop some advocacy resources that can be launched at AIDS 2024. At the conference, which is taking place in Munich in the last week of July, we will have a session at the Youth Pavilion, which is scheduled for Wednesday, the 24th of July. So if you're at AIDS 2024 this year, we encourage you to join us and support us at the Youth Pavilion and see what we have created. And hopefully you get to listen to some more stories about hepatitis and HIV. You can follow WHA Global and World Hepatitis Alliance on social media for more updates about the session closer to the time. And so this is just meant to be as a starting point to a very long journey, I hope, where we can continue to build on the work on hepatitis, HIV, and the important role young people play in it. So that's all from us today. Thank you everybody for joining. If you would like to get involved, please, I encourage you to fill out the feedback form that will be sent to you after the Zoom call. We would love to hear more from you on your experiences and your stories. Thank you everyone for your time. Have a lovely rest of the day.
Thank you all our speakers and to all our participants today. Bye from me.
Thank you, everyone. Bye.
Bye.